SAMA, the Sudanese American Medical Association, is a U.S. nonprofit organization working to improve healthcare services in Sudan through education, training, equipment, and supplies provision. SAMA has worked in several programs targeting the major healthcare issues in Sudan, of which is SAMA's Women's Healthcare Program. According to the United Nations, in Sudan, 311 mothers die out of birth complications per 100,000 live births. This is in comparison to the US rate of only 14 out of every 100,000 live births. Hemorrhaging, excessive bleeding after birth, is the main cause of these deaths. So the Sudanese American Medical Association has initiated several programs to improve women's health and to combat that cause. In 2016, SAMA has partnered with Tobago to introduce international midwifery training modules in bleeding after birth and eclampsia. Since then, 46 master trainers on bleeding after birth and 21 on eclampsia have been certified to carry out the training in all states across Sudan. Over 600 midwives have been trained in combating bleeding after birth and received midwifery kits. We have been able to do so by contributions from individual donors like you, with the knowledge that $100 can train a midwife and provide a kit sufficient for 5 deliveries. Massive population movement and displacement because of civil conflicts and droughts, as well as high adult illiteracy rate, of which are mainly women, have led to low quality of health, as well as the low population awareness of healthcare services. So, to further SAMA's mission to provide healthcare for all, SAMA is partnering with local organizations to manage Omar al-Nifadi Primary Healthcare Clinic in Haj Yousef, a suburban area in Khartoum. This clinic serves a large needy population who otherwise cannot afford the care they need most. In this clinic, SAMA plans to provide high-quality care by hiring highly qualified staff and paying them wages comparable to those of the private sector. SAMA also intends to train, manage, and monitor those staff performances throughout. Furthermore, SAMA will provide consumables, supplies, and required medications. This all will be done through adopting the universal healthcare policy where everyone receives care regardless of their financial ability. In Sudan, there is very low public healthcare spending, with approximately 8.4% of the government expenditure going to public health spending, according to the WHO 2015 data, which means that there is high out-of-pocket expenditure rising up to more than 60% of the total. There is also fragmentation due to the existence of multiple providers, and there's only 3 physicians per 1,000 population estimated in 2014. In 2012, there is an estimation of less than 1 hospital bed per 1,000 population. This and many other reasons, such as disproportional distribution of health providers with 6 doctors to 1 nurse, and a huge gap, especially for allied healthcare workers, have led SAMA to plan to introduce more programs in the following year. Your contribution today will provide these people with a safety net for healthcare. Help us help them. To donate, please visit our website www.samasd.org/donate.